Hello guys, I am Dr. Mukul Mohindra, your orthopedics mentor here at Unacademy, and I am here to discuss with you a little about the healing of fracture, the stages behind fracture healing, and what if a fracture does not heal, does not unite. Why this topic? Well, let me tell you, because this is a very common question that has been asked in your exams a number of times. The first clinical stage of union is, and whenever this question comes, a number of my students they fight with me because they are confused as to what is the right answer. I've had people taking this up, I've had people taking this up, but actually, this is the correct answer, and very few can actually make out as to how this is the correct answer. So, let me take you through the stages in which a fracture unites. Bone fractures, bleeding occurs, blood organizes, and an organized blood, you call it a hematoma. So, that is the first stage of fracture healing, hematoma formation. Now, please understand that this hematoma basically contains chemotactic factors. Now, these chemotactic factors would invite in the fibroblasts, they chip in from the periosteum, these fibroblasts. And once fibroblasts penetrate this hematoma, the hematoma is now better called as granulation tissue. So this is the first stage of fracture healing, hematoma formation, and this is the second stage of fracture healing, granulation tissue formation. Now please understand, this granulation tissue, it's full of growth factors. Granulation tissue has a number of growth factors. Now because of the growth factors, the fibroblasts in the hematoma grow and differentiate. They mature and they differentiate. And they differentiate, and these fibroblasts they now start becoming osteoblasts. Now you already know osteoblasts, bone forming cells. So these osteoblasts they start forming immature bone, and the immature bone that they form is called as callus. So this is the third stage of fracture healing, callus formation. Quick repetition: bone fractures, hematoma forms. The chemotactic factors in the hematoma drive in the fibroblasts, and the fibroblasts convert the hematoma into granulation tissue. Granulation tissue is full of growth factors. They make these fibroblasts grow, mature, and differentiate into osteoblasts. These osteoblasts form immature bone that is called as callus. Now please understand the problem with callus. Soft structure, soft structure. Even if callus is formed, you can still have movement at the fracture site because callus is basically a soft structure. So if bone has to unite, callus has to become rigid, hard, strong. And for anything to be hard in the body, it has to have calcium. Like teeth, they are strong because they have calcium. So that is what happens next. That is what happens next. This callus undergoes mineralization. So basically, calcium deposits in callus, and as calcium deposits in callus, callus basically becomes rigid heart. And this rigid heart callus is almost synonymous with this word woven bone, or as some people also like to call it, consolidated bone. So this is the fourth stage of fracture healing, woven bone formation, and it is woven bone that is rigid hard, that is strong, calcified callus. A bone is basically a combination of calcium with collagen. That is what makes up the bone, collagen with calcium. So apart from calcium in woven bone, you will have collagen. And what will be the pattern of collagen in woven bone? Everything is there in the name. Interwoven means haphazard. But I hope you remember when you used to draw diagram of a bone, you used to draw the collagen in layers, and these layers you would call them as lamellae. In the center you would draw a blood vessel called the Haversian canal, and in between you would have these osteoblasts. So what I mean to say that in a natural bone, collagen is present in a lamellar arrangement, layered arrangement. So that is what happens next. That if this woven bone has to become a natural bone, then collagen has to attain a lamellar pattern. So that is what happens in the end. Collagen becomes lamellar, and once collagen also becomes lamellar, you have the last stage of fracture healing, that's basically called as remodeling. So that is how you finally reach the natural bone, by a step called remodeling. And bone is always remodeling, because bone is a dynamic structure. It's not a static structure. Every day, some part of the bone that's eaten up by bone eating cells, osteoclasts, they create this fracture. And every day, the same fracture is again healed by bone forming cells, osteoblasts, they heal the fracture. So I'm going to say bone keeps on replenishing itself a little every day. And the same formula bone uses if there is a fracture, even to make a fracture unite. So I hope you're clear with the 5 stages of fracture healing. And if you're clear with these stages, I'll quickly also tell you the timing of these stages. Hematoma would completely be organized in like 2 to 3 days. In 3 days, there's complete organization of the hematoma. Granulation tissue formation would generally be complete in like 2 to 3 weeks. By 3 weeks, you have full granulation tissue formation. Callus would completely be formed in like 2 to 3 months. By around 3 months, there is almost complete callus formation. Bone would become rigid hard in like 2 to 3 years. So it takes around 2 to 3 years for the bone to gain its full strength to consolidate. And this remodeling is an ongoing process. It will continue after the 3 years time for the life of the patient, because bone is a dynamic structure. It keeps on remodeling all over life. So with this formula of 2 to 3, it becomes very easy for you even to memorize the timing of the fracture healing. Hematoma complete formation takes around 3 days. Complete granulation tissue formation takes around 3 weeks. Almost complete callus formation takes around 3 months. Gaining strength for the bone takes around 2 to 3 years. And remodeling continues after 3 years for the life of the patient. Yes, I must also tell you a little bit about the pH changes during the healing process. So you have 5 stages: 1, 2, 3, 4, 5, as I've just told you. And as I've just told you, the third stage would be callus, and then calcium deposits in callus, and you go to fourth stage, woven bone. So this is the third stage, callus, and this is the fourth stage, woven bone, and you have calcium depositing here. Now please understand that calcium is an alkaline structure, alkynyl thing. So till calcium is not there, the pH would generally be acidic. But once calcium comes in, the pH would generally go alkaline. So what I mean to say that in the early stages of fracture healing, you generally have the acidic pH. But in the later stages of fracture healing, the pH becomes alkaline. So that is how also we can guess whether the fracture is healing or not, by the pH changes. But yes, with timing, when you know the insight of all stages, you can always guess whether a fracture is healing or not. Because once you know the stages, you will automatically pick up which will be the earliest stage you're going to find on an X-ray. I don't think I even need to tell you, out of all these stages, the earliest thing you would see on an X-ray, callus. Yeah, look at this X-ray. This whitish shadow you can see, this is callus. This whitish shadow you can see, this is callus. So this is the earliest stage that you see on an X-ray. In fact, you can note down with me a few MCQs. The earliest X-ray stage of union, Callus formation. That is the earliest X-ray change that comes up when a fracture heals, Callus formation. But mind you, I told you myself only that callus, that is a soft structure. So even if callus is there, you can have movement at the fracture site. The fracture can move. So it is woven bone, that is rigid hard, where the fracture does not move. So now if the examiner asks you the first clinical stage of union, clinical means apply as much pressure as you want to, the fracture site is not going to move. So here the answer will become woven bone consolidation. I hope you are clear with the difference between the two questions. The first X-ray stage would be callus formation. The first clinical stage will be woven bone formation because it is woven bone that is rigid hard. And yes, if you have to predict union, the clinical stage comes after the X-ray stage. It is the X-ray stage that comes first. So if you have to predict union, X-ray would give you the earlier changes. And you already know that first thing you would see on an X-ray would be callus. And the minimum time it would take for callus to appear, 3 weeks. Because only I told you the timing of the stages. And there I told you that callus would be completely formed by 3 months. But the first sign of callus you will find around 3 weeks when the granulation tissue will start becoming callus. So that is what I'm trying to tell you, that when the granulation tissue starts becoming callus, you start finding callus, and that earliest time would be 3 weeks. If the examiner asks you, when can you see provisional callus? When can you see first sign of callus? Or callus would earliest be visible by 3 weeks. And absolutely from the same table that you have drawn, you can also pick up the time for implant removal. Suppose we have fixed a bone with a nail or a blade, and your patient says that he's not finding it comfortable, he wants to get the implant removed. So what would be the appropriate time? You can only remove an implant once you feel the bone is rigid hard, it has gained all its strength, and the minimum time a bone would take to become rigid hard, 2 years. So never remove an implant until unless the bone is consolidated, the bone is rigid hard. So please write down implant removal minimum needs around 2 years because it needs the bone to consolidate, become woven bone, get deposition of calcium. That is the answer. And let me tell you, you should ideally not remove an implant because even removing an implant can lead to infection, damage to a neurovascular structure, will lead to a complication. An implant can stay in the body of the patient for lifelong because it's an inert material. But sometimes an implant is complicated. It's impinging somewhere, causing pain, causing some problem. You want to remove an implant, try to dodge for around a couple of years so that the bone consolidates and then only remove an implant. And yes, callus is completely formed by 3 months. But yes, sometimes even after 3 months, you can see the fracture line, like in this X-ray. And then you know it becomes delayed union, non-union. Going by the US FDA, you generally label delayed union when you're unable to find callus by around 6 months. And you label the same thing as non-union when you're unable to find any sign of healing any callus by even around 9 months. Although this is not a strict kind of a terminology for delayed and non-union, because for some fractures like neck or femur, even at 3 months you label them as non-union, but this is the gross terminology. Long bones, even by 6 months you label them as non-union. But yes, on a gross basis, by around 3 months you would find good amount callus. Don't even find it by 6 months, you are still able to see the fracture line, will be delayed union. And when you do not find progressive signs of healing even by 9 months, callus is not coming up, fracture line is still visible, you label it as non. So all from the same table that you have just drawn. I hope you've understood everything. I hope you liked the class. You wish to attend few more free classes? Feel free to log on to this platform, Unacademy, unacademy.com. In case you wish to find me, then this is my Telegram link. There's a Facebook profile I hold by this name. You can also catch me up on Facebook, or you can even WhatsApp me up or catch me up on Telegram. If you want to attend more free classes by me, then generally I take them on Tuesdays. But this month, I'll also be taking free classes on Mondays and Fridays around the same time. But yes, the best way to catch me up would actually be by taking a subscription only. Because if you take a subscription, you stay in touch with me, learn a lot more things than just these free classes. And if you really like the class, please do not forget to click this bell icon on Unacademy YouTube channel. And yes, if you plan to take up subscription, I must make you aware of the prices also. Look at the prices. Look at the prices for even a period of 6 months. If you break them down, that just comes out to be a small share of your pocket money. But so much to gain, such a small price. And fairly easy to subscribe. Just visit the site and you will find the way. So would love to see you as subscribers on Unacademy. Hope you like the class. In the end, I would say stay fit. Fit means follow me up. If you like the class, I means invite more friends, and T means take care. See you again. Bye bye.